it changes their mindset to an empowerment mindset of that I can do this. I have a support team. And that's what I say. I say, build your team. It shouldn't just be one of us working. It should be all of us. And if you don't know how to build your team, you don't have the resources or the knowledge or the insurance coverage or whatever it might be, let me know because I will reach out to my connections, my resources to try to help you build your team.
This is the LaRae Journey podcast on the McKissick Health Podcast Network. I'm Dr. Sherella Cupid, your host. The LaRae Journey podcast is a space for Black women to choose themselves. Welcome back, sisters, sponsors, and supporters of the LaRae Journey podcast. For the 4th season, the theme is transitions. We will continue the sister circle conversations with Black women from different stages of life with various personal, community, and professional roles. The intention of this season is to continue and start conversations on the meanings, experiences, and practices around transitions, such as becoming a mom, shifting careers, and establishing a new lifestyle. Thank you for being a part of the LaRae Journey community, because LaRae means love is real and eternal. So sis, let's practice love. Hey sis, it's a new month, and I want to be sure to tell you our summer pick because time goes by quickly. Our summer pick is Call Out There by Dr. Tahira Chloe Mahdi and Christopher A. Brown. I read this book in 2 sittings. It definitely had me cracking up. And also, it made me think about the importance of home, belonging, exploration in order to return to self or remember self, find self, all of the ways in which we explore who we are in the spaces that we occupy as we navigate adulthood. This screenplay is also a platonic comedy, a platon-com, as the authors have stated. And what's more is that this screenplay is currently being produced by the authors to become a hit film coming out this summer. So if you love a book that becomes a movie, a screenplay to film adaptation, so be sure to get your copy by Tahira Chloe Mahdi and Christopher A. Brown. I'm super excited about this pick because the author, my sister doc, Dr. Mahdi, Dr. 99 will be in conversation with us, moderating the talk. So if you also love to be in conversation with multi-hyphenated artists, be sure to go to podcast.mckissickhealth.com and sign up for the LaRae Journey newsletter. That way you can get your invitation to the book club, Our Sister Show. And if you want to learn more about this sister doc, Dr. Mahdi, you can also check out the 2nd episode of season 3 of the LaRae Journey podcast, where I hold conversation with my dear sister doc to explore how she defines love. I'm sure it will give you more insight into how she navigates the space as an artist. I'm pretty sure June will be here faster than you know it. So be sure to grab your copy. So be sure also to support small bookstores by going to bookshop.org. There you can support the bookstores connected to the LaRae Journey community, being One Choice or Left on Red. So today we are in conversation with RaGina McKissick. I'm really excited to be in conversation with RaGina. So RaGina, can you please introduce yourself in a couple of sentences?
My name is RaGina McKissick. I am a social worker as well as a fitness professional.
Thank you. How long have you been a social worker and fitness professional?
I have been a social worker since 2012. I have been a fitness professional since 2013, so quite a while.
Yes. Okay, decades plus. Okay. What brings you to this sister circle place?
I came to the Sister Circle place because as a social worker and fitness professional, I feel like that I can offer some insights to people in regards to their health and wellness journey, because sometimes people think that it's a sprint and it's actually a marathon. And there's lots of different stages, transitions. Everybody's journey is different. So I wanted to talk to people and let them know how they can best go about their journey in order to be successful.
Thank you. So, with this in mind, with this perspective in mind of how you look at fitness, if you can name this season of your life, what title would you give it and why?
I would call this season the push through. Because sometimes when you're in your health and wellness journey, you feel like you just can't keep going anymore. You know you've been going really hard. You've been consistent. You still might not be where you want to be, and so it's annoying you or irritating you or frustrating you, whichever adjective you want to use. And you're wondering if I should even keep doing this anymore. Or, you maybe have a minor setback with muscle overuse or fatigue, or you might have an actual injury that you're trying to recover from. And then that can be another setback. And so you start getting into your head and you're just like, I don't even want to work out today, or I don't even want to eat healthy today, or even drink my water today. But then you have to look at that goal. And that's what I always tell people. I'm like, one, give yourself grace because every day is a challenge. And so you aren't always going to want to be in this journey and do this. But think about what your goals are. If they're health related, like you're diabetic or something like that, or high blood pressure, if you're pregnant and you're trying to be your best self to have a healthy, delivery, if you're postpartum, trying to find your new best self after having your baby. If you're an older person and you're trying to prolong living longer by having more muscle growth and things like that, because more muscle helps you protect your bones and everything to live long. So, whatever your reasons are, thinking about those and then pushing through. Because if you just get over that hump, you'll feel so much better. If you just are like, all right, I'm going to push through and go do my 15-minute walk. I'm going to push through and, go do the class that I'm paying a ridiculous amount of money for, a membership for, or I'm going to go ahead and log on to YouTube or whatever it is, go see my trainer, whatever it is, drink my water, eat my healthy meal. And you do it, it replenishes you in all the ways that you need to say, all right, I'm gonna push through and keep doing this. And that's the go-to thing that I say to all of my clients. Push through, push, push past what your mind is telling you right now. The body's stronger than you think. Um, Push past what other people are telling you where you should be. And that's a model that I live for myself as well, because we all have pressures. And so this season for me is the push through in so many ways, not just in health and wellness, in my personal life, in my spiritual life, everything this season for me is push through.
Okay, so within your season being titled Push Through, and you said that it's showing up in different areas of your personal life, are there any philosophies that you take from your fitness expertise and apply it to those other areas of your life?
Yes, actually. When you're doing your fitness journey, like I said, it's a marathon, not a sprint. And so you have to build up endurance, you have to build up stamina, you have to build up patience. And so I take all of those with me into all of the areas of my life, especially in this season that I'm having of struggling in different areas and having to push through them. And so I'm learning that I have to be patient and I can't rush the process. That's something that I also say to my clients in the health and wellness journeys is you can't rush the process. Okay. It's not an overnight success. They'll tell you it is on, social media or Google, this 30-day fix, this 7-day fix, but it's a temporary solution, not a long-term solution. And so, um, you have to trust the process. You have to be patient. You have to build up that endurance, that stamina, which is why life has so many tests and trials. It builds up your endurance. It builds up your stamina to be able to continue to push through the day to day of your journey of your life.
Thank you. So, with this season being titled Push Through, how are you defining love?
So I would define love in this push through season as giving myself grace, like loving myself enough to give myself grace. Because sometimes you don't want to push through, you want to give up, especially when there's so many things coming from so many different angles. I was just talking to someone the other day about that. It's like, if it's not this part of my life, is this part of my life? And if it's not this part of my life, is this part of my life? And then sometimes it's all of them together. And when it's all of them, or when it's multiple things coming at you, you just feel defeated. You just feel beat down, and you're just like, I don't want to push through anymore. But you have to love yourself enough to own that. Don't deny it. A lot of times people want to deny it or hide how they truly feel. No, it's okay to feel that way. Express it, get it out, talk to somebody about it, be honest with yourself, and love yourself despite the fact that you're feeling that way. Because that's the only way that you're going to be able to push through and go forward, is if you first acknowledge where you truly are mentally, spiritually, emotionally, physically. Um, and if you don't do that, then you're not going to be able to progress. So you first have to acknowledge where you are, love yourself right where you are, in order to push through to get to where you want to be.
That's good. Thank you. So, in the opening, you discussed that you work with a woman who are postpartum, women who are pregnant. I want to dive deeper into women, the pregnancy journey of women. So, for this season, we've talked to doulas, gynecologists. Previous season, we've talked to mothers, and also this season, and even mothers on their fertility journey. So, mothers going through IVF. So, we've had a range when thinking about motherhood. And also, a lot of these mothers will now, quote unquote, be considered to be geriatric pregnancies, right? Or older moms,
Mm-hmm.
which is often considered like automatically a high risk category.
Yes.
So, in thinking about women who are classified as high risk, what recommendations do you often give them on their pregnancy journey?
Excellent question. First of all, I would recommend to them to first give their body grace, because they realize that they are at a certain age where they're considered geriatric or high risk. They immediately get into their head about where their body should be, or beat themselves up about where their body is. Saying, I wish in my, 20s, or I wish in my 30s, or, whatever age they pick, that I had done X or I had done Y. And they immediately start from a place of defeat. So I always like to encourage them to give themselves grace, and that just because you're older, and considered high risk, that's not the end all be all. There are still so many things that you can do in order to still have a healthy pregnancy. So then once I say that to them, I immediately start talking about what they're currently doing in order to keep themselves healthy, and as well as they can be for their journey. So we start talking about their daily life, what they do for a profession, if there's somebody who's active, up and mobile, moving around throughout the day, walking, whatever, or are they somebody that does, as we quote, the desk job or the remote job where they're, constantly sitting around. So once we figure out where they are with that, then we can say, okay, how to build a routine around your daily life, because that's the biggest thing, that is sometimes a setback for everyone, not just prenatal women. If you are not able to build fitness into your daily life and routine, then it becomes like a chore, something that you don't want to do. It is taxing, and most of the time you're not going to stay consistent. But if there's ways to build it around what you already do, then it just comes, it just flows. So we talk about that. Then we talk about if they do have any type of health restrictions or anything like that, that their doctors give them any type of underlying medical conditions or anything like that, so that we can determine what is best for them. Because every pregnancy is different, every woman's body is different. Even if they might have the same diagnoses of something, still the human body is different, person to person. So talking to them about what they already have going on, and what actions they're taking with their doctor and other medical professionals to be able to either remedy it and completely, have it go away, or to maintain it and, as best as possible throughout the pregnancy. Um, and so I tell them, if they haven't already talked to their other professionals in their life, to do that and let them know what they're trying to do. Because I never want to work with a mom who hasn't talked to her GYN, who hasn't talked to her primary care physician, who hasn't talked to, if she has a doula, if she has a midwife, like talk to all the rest of the professionals that are going to be helping her through this journey, so that we can collectively work with her in order to have a successful pregnancy and delivery and postpartum journey.
Thank you. Something that you said that I found really interesting is that women who are considered high risk often start with the mindset of defeat. I'm just wondering how the mindset may be shifted or challenged once you do have those conversations of practicing grace, and also to have conversations with their entire health team.
Yes. So I've seen it shift because then they feel more empowered. I said it earlier that I'm a social worker, so I'm all about empowerment and self efficacy, and you feeling like autonomy. You feel like you have some control. Because pregnancy, a lot of times you don't feel like you have control. Like your body is doing all kinds of things, going through all kinds of things. Some of it you might understand, some of it you might not understand. You might not know anybody else that's going through what you did when you while you're pregnant or when they were pregnant. And so by having these conversations with these other medical professionals, by giving yourself that grace, that love, it changes their mindset to an empowerment mindset of that I can do this. I have a support team. And that's what I say. I say build your team. It shouldn't just be one of us working. It should be all of us. And if you don't know how to build your team, you don't have the resources or the knowledge or the insurance coverage or whatever it might be, let me know, because I will reach out to my connections, my resources to try to help you build your team. Because by doing that, I've seen so many moms have way better outcomes when they have that full team support, including their partners if they have somebody who is going through this journey with them, family members if they don't have an actual partner with them, friends, spiritual professionals as well. Like I try to bring everybody in. I say build your village, build your community, build your team, because that's going to be what helps you get through this process when you are feeling like I just don't know anymore. Like it feels like everything's out of my hands. Having all these people pouring into you to help you continue to build yourself up, so that you can keep doing the tasks that are going to help in the long run for this journey.
That's good. I appreciate you saying that. I think I've been seeing recently, like, that it not only takes a village to raise a child, but it takes a village in adulthood. So I appreciate you uplifting the necessity of having a team and building a team.
This episode of the Lorraine Journey podcast is sponsored by Left on Red. Left on Red, founded by Dr. Latasha Ely Kelly, is a specialty bookstore and cultural space rooted in the mission to amplify representation, cultivate perspective, and empower community, with a focus on titles by Black authors and works of African American interests. The curated collection spans a range of genres and lived experiences, alongside thoughtfully selected stationery, keepsakes, and collectibles that reflect Black culture. Left on Red also hosts events, workshops, and programs that connect literature to everyday life, learning, and well-being. As the home of the Millennial Black Professor and TMBP Media, Left on Red expands beyond the page through podcasting, storytelling, and creative media initiatives that honor underrepresented narratives and foster meaningful dialogue. This space exists to serve, support, and shift, offering both inspiration and intention for anyone seeking reflection, knowledge, and community. You can support Left on Red by visiting leftonredbooks.com. Again, that's leftonredbooks.com, or visiting the bookstore in Wichita, Kansas. Again, thank you, Left on Red, for sponsoring the Lorraine Journey podcast.
So I want to also talk about women who have birth through C-sections.
Yes.
What recommendation would you give them during that healing process? when do you recommend, for example, that they resume their fitness journey? Like, what does that look like for women who have birthed through C-sections?
Excellent question. And I actually just talked about this with a few moms in my last class on Thursday. So a lot of times women going into pregnancy, they, automatically know that they want to do a vaginal delivery. Some women go in knowing they want to do C-section. I've had a mom who, as soon as she found out she was pregnant, she was like, "RaGina, just let you know, I'm going to do a C-section." So I don't know if the training is going to be the same throughout this process or if we need to switch things up, but I want you to know I'm not doing it. I'm getting this. I said, okay, I'm glad that you're being completely honest with me. You know what you want, but if you decide to change your mind, you still have plenty of time before then to decide. She's like, no, oh, no, we already picked the date and everything. I said, okay. So we'll go about things in this manner. So, the training does differ a little bit if you're going to have a C-section versus vaginal. And sometimes you don't know that you're going to have a C-section until you're in the delivery process. You're going through your labor process and the doctors say, we have to go in and get the baby for whatever reason. And that in itself is traumatic. I've worked with several moms who the whole time thought they were going to be doing vaginal deliveries and then wound up doing C-sections. And once again, that mindset set in of what didn't I do right? Why do I have to, go this route? I've done all of this prep work. I've done all this, fitness training. I ate right. I did everything. Why do I still have to go this route? And so the first thing I like to tell moms, if you have to go the C-section route, is that's not the end of the world. Nowadays, more and more women are choosing, like I said, to have C-sections. So if you have to go that route, don't think like, oh, everything else that you've done up to that point was a waste of time because you're going, having to go this route now in order to have a safe delivery of your child. It wasn't a waste. The body still has memory, all right? The body still remembers what you've done. So leading to your other question, when you are in your postpartum and you've had a C-section, the recovery process will differ depending on what occurred during that process. So the healing process is different from pregnancy to pregnancy, woman to woman. And so that recovery period can differ, but most of the time, a doctor will not clear you to resume physical activity. You can like walk and things like that. But even some moms, even with like a walk, like going outside for a walk, going up and down their stairs is limited depending on how their procedure went. But most doctors won't clear you for actual fitness activity until you're 6 weeks postpartum. If you've had a C-section with any type of complications, that can look like 8 to 12 weeks, sometimes 16 weeks. Once again, all depends on how your body is recovering from the procedure. Me personally, as a trainer, I will not train a mom if she has not been cleared by her doctor to come back. And one of the questions that I asked when they resume training with me or start training with me, if they weren't training while they were pregnant, training with me while they were pregnant, is how did your delivery go? And if I find out that, especially if it was one of my moms who I thought was going to be vaginal but wound up in a C-section, I'm asking how that process went. And, they tell me all the details. And I'm like, I'm not shy. I'm not afraid to hear about blood or, anything else I need to know in order to be able to, plan your fitness programming journey moving forward. And so once they share that with me, once they share how their recovery has been, what their doctor told them as they were getting cleared, and then how they're feeling that day in that moment, as well as how they've been doing, in their day-to-day life, caring for the newborn, maybe going back to work, depending on how long they were able to take off work for maternity leave, all of that factors in. And then we start talking about what they can actually do to recover. And I tell them, once again, it's a marathon, not a sprint. You do not just jump back into your fitness when you have a C-section or even a vaginal delivery, but definitely not when you have a C-section. Because when you have a C-section, they have to, of course, cut you open, and then they have to move internal organs and tissues and flesh and everything in order to be able to get the baby. And then they, package everything in. These are not medical terms, of course, but package everything back in. Um, and everything has to readjust. And so your core strength, and everything in fitness starts with your core. And so your core strength already was deteriorated because of carrying the baby and what the baby does to the core as a mother gets further and further in pregnancy. So then to have to go through the C-section, and everything being taken out, putting back in, the body went through a trauma, a major trauma. And so therefore you have to be very sensitive in everything that you do with your core. Hence why I said sometimes a mom can't even do the stairs in her home. One of my moms had to resort to staying downstairs for the first couple of weeks after her C-section. And so her husband had to completely redo their downstairs living area in order to make her comfortable, because she could not maneuver her stairs. Because contrary to what people think, climbing the stairs uses your core. Yes, it's about your legs and things like that, but it also utilizes your core. So that's the first thing I talk to the moms about, is about we have to focus on your core right now, rebuilding the core strength, before we can dabble into anything else. If you're somebody who wants to get back to running, swimming, kickboxing, spin classes, lifting, weightlifting, any type, or just going, like I said, for a walk with your dog or your child in the stroller, rebuilding that core strength is essential. And that's our starting place. And even during the exercises with core, sometimes when you're training with someone who's not certified in prenatal postpartum and not aware of a woman's body and the trauma that it goes through from having a C-section, and a high risk C-section at that, they don't even know how to go about giving you the exercises to strengthen your core that are actually safe for you to do. Sometimes they will have you trying to do a crunch or a sit-up or a plank. All of that is bad when you are in postpartum, especially if you've been in a C-section and postpartum. That is not the way you rebuild your core strength. There's other exercises that we can do to rebuild the core without doing ones that are going to harm you further. So just giving the moms that knowledge, so that way, if they don't stay training with me, or maybe they only do a consult with me and then maybe go train somewhere else for whatever reason, then at least they have that knowledge that, all right, I know I'm not supposed to do this. And that's what I'm always about, is giving knowledge and information. So that way, if you don't stay working with me, you have to move away, your work schedule gets crazy and we can never meet, at least you have those tools, those go-to exercises that are going to strengthen that core back. For example, like a dead bug or a bird dog, which are exercises that might look easy, but they're not, especially for a woman who's trying to recover her core.
Okay, I've never heard of any of those exercises. It sounds like yoga moves.
They
were saying it.
They do stem from yoga.
Okay.
And then in the other fitness genres, we basically stole it and then added weights to it and balls and bands and all the rest of that kind of thing. But they did stem from yoga. And a lot of physical therapists honestly use it too. So a lot of my moms go to pelvic floor therapy after having their babies, which is highly recommended. And a lot of them do it there too. So when we're doing it in my classes and they're in pelvic floor therapy, they be like, "Oop, we just did that in pelvic floor therapy." I'm like, "Good. Well, we're adding weights to it." So
Thank you for sharing that. Another aspect that I'm interested in, as you were talking, was about moms in the prenatal process through IVF and how that may impact their fitness journey. Are you able to talk about that as well?
yes. So first of all, the IVF process is strenuous. It is not always successful. It is very taxing on the woman's body. And a lot of people don't understand that when they're looking from the outside. Even sometimes the partners who have a partner going through IVF don't really understand it. So first, I always am like, I hope that your doctors are educating you on what still, even though they tell you what it's going to be like, you still don't know until you actually go through it. And also the reality that it might not be successful on the first try. And so deciding if you're going to do it again. It's also very expensive. So deciding if you're going to do it again. I had a mom who trained with me. She was on her third round of IVF. Thankfully, that third round was a success, and she had a healthy pregnancy, delivered a healthy baby. But once again, having that conversation, that we have to be careful. And so when a mom comes to me and says that I'm on IVF, whether it's round 1 or round 3, I definitely have that conversation with her of wanting to make sure that we are hyper aware. Like, we're already super aware, but like hyper aware of everything that she does in regards to her health and wellness journey. I am not a certified nutritionist or anything like that, so I don't touch on anything that I'm not qualified to. So I recommend, once again, building that village of professionals. So I'm like, okay, make sure that you have all of these other professionals guiding you through this process, so that you have the best outcomes. In regards to the fitness part that you're going to be doing with me, we are going to make sure that at every single point of this journey, you're constantly checking in with me. So that way I know how things are feeling towards your body. Because of how strenuous it is on the body. Most moms, when they're prenatal, the exhaustion is there, the fatigue is there, all of that. But for a mom who's going through IVF, it's even heightened more because of all of the procedures that had to be undergone in order to have a successful process. And so, once again, talking to the mom about grace and loving your body, because it might be a day where she comes in and we can't do anything but just sit there. And one time that happened with one of my moms who was on IVF. Like, she came in, she thought she would be able to work out that day, and she just sat and cried, and we cried together. And I'm like, that was the social worker in me. I'm just gonna be here with you and be present, and you let me know what you need. And she was just like, if you could just hold my hands, and can we just sit? So we sat for the whole session, and by the time she got done, I was like, how do you feel now? And she was just like, I needed to release. I couldn't work out today. I just needed a release. And I'm like, that is totally fine. And I'm like, and every time that happens, don't be afraid to do it. Whether that's with work and you just need to step away for 10, 15 minutes and have a release, whether that be stepping away from your partner, not training today with me, whatever it is, give yourself grace, love yourself enough to have that moment, have that release. They also have a lot of fear when they go through the IVF process, fear of messing up, and possibly, losing their baby. Just like all moms, but once again, IVF moms, it's at a very heightened level, that fear. And, once again, trying to say, we don't have a crystal ball. Nobody does. So we don't know how this is going to turn out. All we can do is take the best steps possible to have a successful outcome, and to try your best not to live in fear. But once again, get that knowledge, build that village in order to make the best decisions possible. And for me, like I said, I'm a teacher when I do fitness with people. And so I'm explaining to them why we're doing what we're doing, how that is impacting the body, how that is going to impact the pregnancy, saying to them that if it impacts it this way, then we're going to adjust and pivot this way, which is why that check-in process is so important. Some of my moms talk to me more than they talk to anybody else, and like even their partner, because of the fact that I'm constantly wanting to know how things are impacting their day-to-day life as they go through that process, but also when they come and see me.
Thank you. So, within those moments where you are uplifting the need for women to rest, to release, and thinking about the experiences that you have with different moms, like you said, you coach moms who have vaginal deliveries, C-sections, experience IVF, high risk, like all of those moms. And thinking about the conversations that you've had with those mothers, have there been any conversations that has enlightened your journey as a fitness coach, or shifted or expanded the way you provide care as a fitness coach?
Definitely, definitely. When I first started this work, I was training moms who were already on their fitness journey prior to being pregnant. So they were already really active and found out they were pregnant and wanted to continue to be active. But then as I kept moving forward in my work, I started getting the other type of moms, the moms who, weren't working out prior to being pregnant, not really knowing how to work out, having lots of questions, having a lot of fear first pregnancy, not knowing what to do or what to do. And then moving further into my journey, then I started getting the moms who came in with different types of underlying conditions like IVF or diabetic or geriatric or had several miscarriages and are on another journey. So training such a variety of moms and hearing their stories and hearing how pregnancy has changed and shifted not just their body but also their mindset, their emotional, their spiritual, like everything. It only grew my passion for this work, but also it enlightened me to be able to work with the next mom. So when I started building out the prenatal postpartum programming for the place that I work at, which is Lumos Yoga and Bar in Philadelphia, I wanted to build a community. I didn't want to just teach some classes because I was certified. I wanted to build that community. So for those moms who didn't have that village that I talked about before, could come to these classes, meet other moms, and possibly build a village together, which has happened so many times over. And it's been beautiful to watch. And I always tell a new mom coming into the community that it's a safe space. And so here we open up and we share the real, because sometimes moms feel like they have to hide how they truly feel and just smile and be like, pregnancy is great, when it's not always great. Pregnancy is a trauma. Childbirth is a trauma. Postpartum journey is a trauma that you're trying to recover from. And so working with all these moms and the different ways the trauma has impacted them and how they've come past it, and been able to be on the journey with them to empower them, to coach them and train them as they go through each of the stages, has been completely enlightening. And so every time I get another mom, I'm able to share from the previous ones that I trained. And when they're in those community atmospheres together, like in one of my group classes or in a workshop that I'm leading, and they hear what another mom, is sharing, it makes them feel like they're not alone. Even if they haven't gone through it, what they've gone through, still, we're in a collective atmosphere where it's just like, yes, we're all different, but at the end of the day, we're all growing humans, or we all had little humans, and together we can stand united in that. So working with moms from all different kinds of backgrounds has truly made me love this work. And people ask me all the time, they're like, "Will you ever go back to training regular people?" And I'm like, first of all, they are regular people, so don't say that. They're just a specialized population that I decided to focus on. But I do still train other people as well. But the prenatal postpartum community is my heart, because I've seen that there's just not enough professionals out there who are doing this work. A lot of the gyms, a lot of the studios and things like that do not have people who are certified in prenatal postpartum to be able to train these mothers. And if they are certified, they don't have the passion. So they're not really, it's about a paycheck. It's about having another client, but not about really helping somebody through their journey. Like I said, I'm a social worker first. So therefore, I'm all about empowerment and building you up and making sure that once our journey ends together, that you can still go on this journey and help somebody else on it too while you're moving forward.
Thank you. I'm curious about two things. One, I've never, besides like, for example, like women who have had went through the IVF process or C-sections or have experienced miscarriages. I've never heard of trauma, like pregnancy being articulated as a trauma. So can you share a little bit more about that?
Yes. So, like you said, a lot of people do not phrase it that way. They do not think of it about that way. Women been having babies since the beginning of time, and so it's just one of those things. And the first thing I tell a mom who comes into my class or into a session with me is we talk about trauma, and they look at me and they're like one woman started crying when I told her, that it was because we don't hear it that way. Like that's not the culture of pregnancy. And it actually is a trauma because of what the body has to endure in order to be able to deliver a baby. And so it's already a traumatic process if you're just going the regular route of pregnancy. But then, like I said, if you add IVF, if you add somebody who's been through miscarriages, somebody who's high risk or geriatric, or who has an underlying medical condition, diabetic, high blood pressure, scoliosis, anything like that, that makes it even more traumatic because of the fact that the body is about to undergo so many changes in order to be able to grow this human inside of a woman. And sometimes women develop things when they're pregnant that they didn't even have prior to being pregnant, especially because of the things, once again, that it takes to grow a baby and to have a successful delivery. You have to gain weight in order to be able to have a successful pregnancy. Some moms are so scared to gain weight because they don't want to be fat. They don't want to, be diabetic. They don't want to not pass their glucose test or, whatever it is that they've been told or they've researched or have heard other mothers say are things not to do. And you have to be careful because there is a certain amount of weight that you need to gain in order to be able to successfully hold the fetus. And so if you don't gain that proper amount of weight, then you'll be malnourished, which means the baby will be malnourished, which will lead to all kinds of complications. So trying to get moms and also their partners and also just society period to understand that this is a trauma. The body is undergoing massive changes that are impacting this woman's ability to do so many things. Like if you have a mom who's on bed rest because maybe she had some placenta issues. And so if she doesn't, take that time to rest and recover and allow the placenta to solidify itself to be able to continue to hold the baby inside her, she could have preterm labor, which means she has the baby earlier than when she's supposed to have. So once again, trauma. You could have a mom who her vaginal canal isn't big enough for the baby to come down it. And so therefore they have to go in and get the baby. There's your C-section, trauma. You could have a mom who has a blood issue. And so there's not enough blood going to the baby. And who knows what kind of things that could lead to. So many outcomes where if there's too much loss of blood to the baby could die. Umbilical cords get wrapped around babies, they suffocate to death. There's, oh my gosh, like these are all horror stories. And I don't mean to say them like to scare a mom or to scare a partner or family members or anything like that, but just to give people the reality that there are so many things that are happening to a woman's body when she is pregnant. And some of them are very traumatic and they have to endure that trauma. Hopefully, the trauma can be remedied, whatever is happening so that they can deliver a healthy baby. But then even delivering a baby is also a traumatic experience. All right, going through the labor process, having the contractions, dilating to the amount that you need to in order for the baby to come out. What if the baby is breached while you're getting ready to deliver? They have to go in there and literally turn the baby over. That is painful. Sometimes the baby is breached and the baby is still in the mom and it's not time to deliver. And they have to do these procedures to try to get the baby to turn the way it's supposed to be in order to be able to come out. That's trauma to the body. If you're delivering a vaginal delivery and the baby is too large for even with you dilating, there's tearing. If a mom's body is so petite and small, but the baby is big, that's trauma. I've had moms who've had severe back issues because of carrying the baby and they were so petite. I've had moms whose abdominal walls have been shattered from carrying children because of their bodies being petite. That's trauma. And so when you have to rebuild, and that's literally what these women are doing after they have babies, they're rebuilding their bodies. That is a traumatic experience that they're trying to come out of. And so, once again, that's why I talk so much about grace and loving yourself, because it is not easy to come out of a traumatic experience. That's why they call it postpartum depression. Like, it's not easy coming out of a traumatic experience. And so, once again, if you don't have that village, if you don't have that support system, that traumatic experience can be even more so feeling like it's unbearable and you feel like you're alone. And sometimes you don't even want to go through with this anymore because it's just so much. And no matter how prepared you think you are for it, you still just don't know. I've had moms who are on baby number 2 or 3. Pregnancy wasn't anything like the first baby or the second baby. And they're like, what is going on? I don't understand. Trauma. So that's multiple traumatic experiences having multiple babies. But then if the pregnancies differ from one another and this baby does something that baby didn't do, the body has already went through something for the first child. So now we're going through it second time, depending on how much time was in between having the babies. If there was enough time to recover from that first one, sometimes it's not possible. Some women have what we call the stair step kids, or the kids where there's not a significant gap in between them. So that means that mom hasn't actually been able to fully recover from the first trauma before she's going into the second trauma. So once again, even more so, needing to have those supports, those tools, those resources, that mindset, in order to be able to overcome and have a successful pregnancy, have a successful delivery, and be able to go through that postpartum journey. That was a really long answer, but I hate the fact that people just think pregnancy is just, oh, go have a baby, go get pregnant. Like, you'll be fine. Like, women have been doing this since the beginning of time. Like, I don't get why women are making, like, I've actually heard people say, I don't get why women are making such a big deal about it. They're just pregnant. Excuse me? Especially when you're somebody that's never carried it. Excuse me? And then even some moms who have been pregnant and delivered babies, and their pregnancies were what they call easy, and they had really smooth deliveries and the comeback bodies of postpartum with no issues. Sometimes I even have to comfort them in a polite way, because sometimes the culture is to promote that so heavy and make moms who didn't have that journey feel bad about themselves. And it's just like, no, 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 sister. We are not about to do that to one another, okay? That's wonderful that your pregnancy was easy. That's amazing that your delivery was very smooth. The baby came out quickly, no complications. Y'all both were healthy, and were able to go home, as soon as possible. You were able to jump back into your life quickly, and your body, looks amazing. That is awesome. I'm so happy for you, but that is not everybody's story. And so while you can go ahead and be happy about your story, also be mindful of other people's story, because you don't know what that mom went through, or what that mom went through. And the last thing we want to do ourselves to each other is to bring each other down, to beat each other down, to make each other feel like I did something wrong. She had that outcome and I had this one. No, 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 no. That's not what we're going to do. So I even have to, because I've trained moms who did have that wonderful experience the whole way through. And I'm like, I'm happy for you, sister. But when we're around other moms, or when you're around other moms, I need you to just be mindful that that's not everybody's journey. And so share yours, because that is wonderful. And so moms should hear that it can get better, or, there's, things that you know what I'm saying? So it's great for you to share the story, but still just be mindful that that's not everybody's. And and give that grace to everyone else.
That's good. You mentioned the bounce back body. Can you share a little bit about that terminology, like what it connotes for folks? Yeah.
Yes. So the bounce back body is a societal term to reference a woman's body getting back small, skinny, snatched, whatever the terms have changed over the years after pregnancy. And so if you had a flat stomach, before you were pregnant, you went through your pregnancy, you had your baby, and within 3 to 4 weeks, 5 weeks, 6 weeks, or whatever, you were back to your flat stomach. That's what they would call the bounce back body. If after your pregnancy, nobody could even tell that you ever had a baby, people be like, "Oh, your body bounced back, girl. You got the bounce back body." And I despise that term. Not that I'm not happy for women who bodies recover quickly after pregnancy. I am happy for them. But I don't like that term because of what it says to other women who that's not the case. The mom who, after she has her baby, quote, quote, still looks like she's pregnant. Ooh, I hate when people say that. And I hate when moms say that about themselves. Like, why do I still look like that I'm, 5 months pregnant after I have my baby? Or 3 months pregnant, or whatever, time frame that they put on themselves. And once again, I have to tell them, give your body grace, and also help them understand why their body looks the way it looks. So if you've had a C-section, once again, they had to go like this, take out stuff, take the baby out, put it all back in there correctly, sew you up, but everything's still like, my hands are not medical terms, but everything is still
Yes.
loose, like you know what I'm saying. And so therefore, you're not going to have that smooth look yet. And once again, you might not ever, if you had the flat, smooth look, you might not ever get that back, but you can get a strong core back. You can get a fit body back, and understanding what that means for you specifically, not what that means for women in general. And so that's what I always try to tell moms, and also just tell the community, period. Stop talking about the bounce back body. Just talk about you getting back to your best self. And if that best self looks like what you look like before you were pregnant, or looks like what you look like when you were 20, great for you. But for every other mom that's not the case, getting to their new body, getting to their new self. And I say the new body, the new self should come from a place of strength. All right. Not about getting my body back or getting a flat stomach or abs back or anything like that, but getting strength back. And that's that core strength that I talked about earlier. Having core strength leads to not having back pains. How many moms have you heard talk about back pains after being while pregnant? Definitely, but after being pregnant, still having those back pains. Taking care of their infants, to their toddlers, to their kids that are in preschool and constantly still talking about having back pain long after having their children. It's because 9 times out of 10, they weren't able to take the time to recover their core strength, which leads to not having back pain. Okay. If you heard mom talks about having hip pains, or, having leg or knee pains. Ooh, I have moms all the time talking about knee pain after pregnancy. And it's not because they have, this weight that they need to get off, where some moms, that's the case. They now have to, get off some weight from the weight that they gained while they were pregnant, in order to safely be able to not put pressure on the knees and things like that. But even when that's not the case, still having knee pain, hip pain, and things like that. If you have a strong core, that leads to strong hips, which leads to strong legs, which leads to not a lot of knee pain or not a lot of ankle pain or swelling feet. So it all connects, but it all starts with the core. And so telling moms, because that's the first thing we look at after we have the baby, is what is my stomach doing? Like, is it going down? That you hear the things about if you breastfeed, your stomach, will go down, and like all of these things. And sometimes that is the case. A mom might breastfeed and her stomach, might decrease. Some moms, they breastfeed the whole time and they're like, my stomach is still where it's at. And it's so, once again, giving your body grace to recover from that trauma, but also understanding that the body has changed. And we have to own that change. We have to accept that change and then take steps in order to get to our new self. And that new self can be just as great and amazing and strong and beautiful and empowered as the self that you were before you were pregnant. It's just a matter of how you go about doing it, having that village, having that community to help you get through that journey. And the moms that I have trained who looked at it from that perspective and who grew that village and all of those things have had such better outcomes, did not go through postpartum depression, or if they did, it was not as extreme as it could have been if they hadn't done what I recommended and been able to love their self and give their self grace. And it's amazing to watch them through the journey to find that new them. Watching they see muscles that they never saw even before pregnancy. They see muscles that they never saw. They might not see the flat stomach, but they know that they have a stronger core because the back pain's gone, or the hip pain's gone, or the knee pain's gone, or they're able to hold their baby in. You probably see moms holding the babies in the front carriers and like walking through. So they're able to hold the baby, walk 2 miles, and nothing hurts. That's core strength. You know what I'm saying? Or, they've realized that their posture is more graceful and upright versus the humpback that, a lot of moms experience. Once again, that's core strength. So them being able to climb multiple flights of stairs, being able to walk long distances, being able to pick up heavy things, that's core strength. Yes, it's upper body and lower body, depending on what it is, but more so it's the foundation of core strength. And so helping moms to understand that my goal, and I tell moms from the beginning, my goal is not to get you a flat stomach. My goal is to rebuild your core strength. That is our starting point, okay? And if it turns out that you get a flat stomach, cool. But if you don't, I need you not to beat yourself up about it. This is your new body. This is your new self. And which would you rather have? Would you have a really strong body, or would you rather have a flat stomach and no strength? Because I've had that happen too. Mom had a bounce back body, didn't feel like she needed any type of, postpartum strength training or anything like that, and wound up having so many issues. But she had the quote, quote, bounce back body and couldn't understand it. She was like, I don't understand. Like, my stomach went back down. Like, I'm, the size I was before I got pregnant, but like, I'm having all of these pains and aches and issues and stuff like that. And I'm like, it's wonderful that your body went back down, but you didn't focus on building your core strength. And so just because you have a flat stomach does not mean you have a strong core. And that's just not for the prenatal postpartum community. I say that to I did it myself. I say that to other people that I train that are not in that population. I tell people all the time, just because you see the skinny person or the person who you think is fit does not mean they have strength. And it's the person that you see and you say, oh, they have a stomach, or, oh, they're bigger. You might think like, oh, they can't possibly have a strong core. You'll be surprised. Okay. Core strength comes from literally within and leads to so many other areas like the back, the hips, the glutes, the knees. And so I tell people, I'm like, don't just look with your eyes, because you never know. So it definitely, that bounce back term, I really hope we can dismantle it and just stop using it completely and start using the phrase, your new you. You might not ever get back to who you were before, but you can find your new you. Same thing with somebody who's recovering from a surgery or, an accident or a underlying medical condition, but now they're, healed from it, and now they're trying to, get back into their health and wellness journey. You might not get back to who you were before, but we can find a new you, a better you, a more empowered you, a stronger you. And that usually makes people way more happy.
That's good. I think as you were discussing the multiple perspectives and women that you work with, two terms that came to mind was healing and also mourning, like the perception that I need to or I should return to this previous self, right? And but you're uplifting and the notion that recognizing that pregnancy is a journey that you arrive at a new identity. So what does mourning look like in this process? Like accepting that I will not ever be that previous self and that's okay. But how do I arrive at this new self and be okay with that? Like those are the
Yes.
two terms that came to mind as you were
Perfect.
describing this process.
Perfect. Those.
Mhm.
Oh my goodness. I'm gonna steal those from you,
Of
because
course.
I love the way you said that, and that is exactly what it is. We mourn for who we were, but don't stay there. Don't keep mourning. Don't bask on it. Don't let that turn into defeat. Don't let that turn into depression, which happens all the time with the moms who I train. It's like, okay, we can mourn her, we can mourn her, but now it's time to stop. And now it's time to find our new RaGina, our new Sherella, our new Sandra, our new, Natasha, our new whoever. And I promise you, this person is going to be better than that person there. Okay. Not only because now you have this beautiful little human in your world, or two humans, or three humans, depending on what your pregnancy was. And I have trained moms with twins and triplets. Oh my gosh, that's amazing in itself. Just having that many trauma, having that many babies, growing that many babies.
Mm.
But yeah, I always tell them, I'm like, that new you is going to be better than you ever thought. And I've been doing this, as you said, for over over a decade. And I can tell you, I've never had a mom who got to that other side and was disappointed. Every single one has been like, thank you. I love her. I love me more than I loved the her or the me that I was before I got pregnant. And not just because of my little human, although I look at my little human and I'm proud that I was able to do this. But also when I look at myself and I'm like, and that's what I wanted to hear, my sister. Like, I want you to look at yourself and see the new you, and see how strong you are, how beautiful you are. One of my classes the other week, one of my moms was in there and she was talking about, and she was considered one of the ones who had a bounce back body. And I love the fact that she felt so honest to be able to share how she didn't like the way she looked. And it blew everybody's mind away because it's like, she snatched, was huge, belly was huge, and she's talking about she doesn't like her body. And after class, I gave her a hug. Well, in class, I said all this empowering stuff to her. But after class, I gave her a hug and I said, "Thank you so much for sharing, because I could see the faces. You do help so many moms by sharing the fact that you didn't like what your body looked like. She didn't like the fact that she couldn't fit into some of her clothes. Now, it made no sense to some of the other moms. It's like, she snatched. How's she not fitting into her stuff? But some of the stuff she wanted to wear, she couldn't. Like, she still saw those imperfections. And so by her being honest that, outsiders might see me as one thing, but I see me as something different, that helped other moms so much. And her husband and I talked to them about having supportive partners, and if you don't have a partner, the village and all the rest of that kind of thing. Her husband was very also empowering to her, which I appreciated. I appreciate people having these supportive villages, because he told her, "Babe, it's okay. We can go shopping and get you some. I don't want you beating yourself up about this. Let's go to the mall. Let's go buy some." And I tell her, I was like, next time I see him, I'm gonna give him a hug too, because I love him for, being able to stand with you in that moment and try to give a solution that actually mattered and meant something, and that was impactful, and empathetic to how you were feeling. And she was just like, so we did like go to the store and get a few pieces, and it made me feel better, that he wanted to do that with me, and everything, because they did go together. He didn't even just like give her the money, like they went together and did the shopping. And I'm like, I love that, because that showed a united front in how you were feeling. And sometimes that's also what we need. We just need somebody else to just stand with us, while we're in that moment of self-doubt or self-shame or whatever it is. And I had to tell them in that class that day, I'm like, you're all beautiful, no matter what stage of this pregnancy, postpartum journey in, you are beautiful. And you need to give yourself grace. You need to love yourself in this phase that you're in right now and every phase to come. Keep loving yourself, okay? Love yourself at this weight, love yourself at that weight, love yourself after delivery, love yourself after your 6-week checkup, love yourself after 4 months postpartum. I have a mom who her baby's about to turn 1 and she wound up having to have a C-section, and she just is like, I don't like where my body is. I've been actively trying to work out and actively been trying to eat right, and I don't like where my body is. And I tell her every time she makes it to class, I'm like, give yourself grace. Give yourself grace. This is a journey. This is a marathon, not a sprint. Give yourself grace. You are doing all the right things, and it's a process, okay? But be proud and I say this to everybody I train, no matter what your background is. Celebrate the small victories. So as a trainer, when we're in sessions, and my job is to notice you. So when we're in sessions and I see a little bit of a muscle definition, oh girl, I see them biceps popping, or oh, I see that back definition, or you got lower in that squat than you did 2 weeks ago, or we increased weight today. Did you even realize that I had you doing more weight today? Sometimes I don't even let them look at like the machine or whatever it is that I have them doing. I just make them do the exercise, and I'm like, you know how much weight that was? And I'm like, no, and I'll tell them, and they'll be like, and I'm like, yes. Or I'll tell them about the fact that when you have a baby, your baby weighs anywhere from maybe 3 to 4 pounds all the way up to maybe a 10-pound baby. And then the baby grows from there. You're constantly picking up this baby, carrying this baby, holding this baby. That's weight training. Okay. So look, you're nodding. Exactly. So that's weight training. So if you engage your core, you hold your baby and you go up a flight of stairs, that's a workout. Okay. So please, let's applaud ourselves. And that's why I say about the day-to-day, the daily life, what they do for a living, what their, movements are throughout the day, because they're working out without even noticing it. So I'm like, so it's not about always going to a class or coming into a personal training session. Sometimes it's about using what you got to do for the day. You going grocery shopping? Oh, y'all walk to the grocery store and walk the groceries home? That was a workout. Like, I don't know how, that was a workout. Walking with grocery bags, that was a workout. Make sure your posture is good. Don't round your shoulders, all right? Make sure you engage your core the whole walk. Breathe in through the nose, out through the mouth. You just did a 30-minute workout walking, home from the grocery store with your grocery. So once again, like empowering them to show that, like, yes, every process, celebrate the small victories. Celebrate the small victories, because the big victory is coming. But celebrate the small ones, because that's the push through, how we talked about all the way at the top of this podcast, the push through. Okay. In order to push through, you have to celebrate the small victories, because if you don't, all you're going to do is see the negative, the big gap to where you need to be, versus embracing and celebrating where you are now and how far you've come.
Thank you. I think this episode sounds like an affirmation track. So I don't know if someone is like watching it on YouTube, if they go back and like listen to it on Spotify or Apple, it definitely sounds like an affirmation soundtrack, which I would definitely say that no matter where we are in life, that we often need those affirmations to remind ourselves to celebrate those steps. So thank you for sharing. Thank you for sharing those perspectives. You have been a fitness coach for was it 12 years?
Yes.
I know fitness coaches, they often have a motto or a saying. Do you have one of those?
I do. And I'm laughing because I've had it since the very beginning. And it was honestly from a personal situation of my own fitness journey. And so my motto is get in where you fit in. I'm Kiss G Fitness, and my motto is get in where you fit in. And I developed that because I was a group instructor first before becoming a personal trainer. And so when you teach group classes, you have people from all different kinds of backgrounds, all different kinds of fitness levels. And so instructors, we have to build a workout and then, instruct, guide, coach everyone through it. And by having people from all different backgrounds and situations and fitness levels, you have to be able to offer those progressions as well as those modifications, ways to make it more intense for the person who has a higher fitness level, and then those modifications for somebody who maybe has a lower fitness level or an injury or an underlying condition or something like that. And so I always would start off the top of my classes with, explaining like what type of class we were doing that day, what type of equipment, yada, yada, yada. And then at the end of my speech, I say, so get in where you fit in. Okay. Like, don't look at the person. And this is literally what I say every single class. Get in where you fit in. Don't look at the person on your right. Don't look at the person on your left, the person in front of you, the person behind you. Okay. It's about you and me for the next 45 minutes, 60 minutes, whatever type of class it is. And us getting through this process. Okay. So if something is not working for you, take that customization. If you want to make this, workout a little bit more challenging, take that progression, lift that heavier weight, give me more reps, go a little bit faster. But at the end of the day, listen to your body, okay? And give your body grace for wherever you are today. Every day is different when you work out. Some days you can feel like you can lift a car. Another day you are like, I just really want a shavasana, which means lay down for the whole class. I'm like, first of all, acknowledge where you are today, own where you are today, and then dive into your workout. And I tell people I'm the same way. Sometimes I go in to teach a class and I'm on 100. Like, it's like, whoo, let's get it. And other days I go in and it's like, whoo, I gotta perform. I gotta push through and get through this class. Empower these people who are coming here to be poured into when I'm not. And that's why I said the whole pour into yourself. When I don't feel poured into is a task, but I push through every time, and we collectively, and I tell people I'm in this with you. On those rough days that I'm struggling, I say to them, I'm like, I'm in this with you, all right? So we're gonna do these last 8 push-ups together, all right? We're gonna do these, last 30 seconds of cardio together. We're gonna get these last reps in together. And I do it in my personal training sessions too. If I can see the mental starting to tap in, then I immediately go right up next to my client and start doing the exercises with them and be like, I'm right here with you. Let's push through this. Let's push past this. Let's finish this. So my motto is get in where you fit in. Okay. Fitness should always be attainable for anybody and everybody. And I hate when there's classes or facilities or gyms or personal trainers who do not understand that philosophy. Okay. You should not ever feel excluded. You should feel included by what the trainer or the group instructor is offering. So get in where you fit in.
Thank you. That's beautiful. I can just imagine myself in one of your classes. Yes, thank you. Quick question. Do you have an extra 10 minutes?
Yes.
Okay. Alrighty. Want to be respectful of your time. So I'll pull 2 questions from the career and then jump to the closing. Okay. So I'm curious about what led you to this career field. You said you first started off as a group instructor and then you navigated to becoming a personal fitness coach. What led you to this career field?
So I've been a dancer since I was younger. Been dancing since I was 7. Started off dancing in church and then branched out into dance. Well, still danced in church, but branched out into dancing in other genres as well. And I got older, went off to undergrad and became a dance fitness instructor because I like the, high intense cardio type of dances like African fusion and hip hop cardio and those kind of things. Even liturgical dancing for church. I would do dance fitness classes, but to Christian music, gospel music, because I just like that high energy. And so I started off as a dance fitness instructor and teaching for places doing that type of fitness. And through my coaching skills and the way that I empower people, my energy, I got noticed by people. And they were like, do you teach anything other than dance fitness? Because everybody's not a dancer. They don't, everybody doesn't like that type of thing. And I said at the time that I didn't teach anything else because I wasn't, certified or anything like that. But I was thinking about getting certified in other areas because I liked working out myself. I also played basketball, volleyball growing up, so like athlete. So I like working out. And so they were like, "Well, if you do, let us know because we would love to get you into teaching maybe some boot camp classes or some HIIT classes." And I said, "Okay." So I wound up exploring that and getting certified as a group instructor to be able to teach those classes. And so I started teaching HIIT, boot camp, butts and gut classes, like those type of fun classes, which was awesome. It was so much fun being able to see so many different people and so many different levels, just feeling empowered and smiling and glowing after class and feeling so accomplished after the workouts. And I loved that feeling. It was like a high. I loved that feeling. And through me teaching classes and people loving me so much, I started getting approached by people like, "Do you personally train? Do you personally train? Do you personally train?" And by them asking so much, they started asking the owners that I was working for, like, "Tell her to get a personal training certification." So one day, one of the places I was teaching at, the owner came up to me and he was like, "You ever thought about being a personal trainer?" I was like, "Not really, but I keep getting approached." And he was just like, "Well, how about this? How about you shadow me and, come in, watch me do some sessions and see how you like it. And if you do, I'll help you get your certification. I will, treat you as my intern. I'll, give you the books and everything like that, help you study and, let's rock out." And I said, "Okay." And I did it. I went with him those first couple of sessions and I loved the way he worked with his people and the way his people embraced his knowledge, but also felt autonomy to be able to still have a say over their, fitness journey and everything. And I'm like, "Ooh, this is so me. Like I can do this." So I interned with him for about 4 months, took my tests, got certified, and then hit the ground running. And like I said, I've trained athletes, people who've never worked out a day in their life, young people, so as young as 18 years old, all the way up to I think the oldest person I ever taught a class to or trained was 72. So even I love training my seniors as well, and teaching those type of classes. But yeah, so that definitely led me into the career of fitness, and then my specialties all developed, or additional certifications all developed based off of just the clients that I was getting. I kept getting more and more moms coming in, or more pregnant people coming in, and I'm like, "Ooh, I think I want to do this population." And then an injury to my knees, I wound up not being able to strength train, which is my forte, which is all strength training. That's what I love for myself. And so I wound up having to take time away from that and do physical therapy and start doing bar and Pilates. And by doing those styles of fitness, I'm like, "Okay, Pilates is awesome. I liked the class. Don't ever want to like teach it." But then I did bar, and I'm like, "Now this is my jam." As a dancer, bar is so in line with ballet, as well as you have the fitness component with all the weights and things like that. And I'm like, "Oh yes, this is totally me." So I wound up in my recovery process of my knees getting certified as a bar instructor to be able to add that to my repertoire. So my own physical fitness journey has led me into this career, but also just my passions and honestly just being being empowering and being a good coach has just led me to each and every place that I've trained, to each and every client that I've trained or taught a class to. It just kept unfolding and unfolding, and I kept getting pushed in a good way, getting pushed further and further into this field. And now I can't see myself not doing this. People are like, "Oh, how long do you think you'll be teaching classes for?" And I'm like, "Well, I'm about to be 37, probably another 50 years." And they laugh and like,
Okay.
"Wait, you want to be a senior teaching classes?" I'm like, "Yeah, I'll just be teaching seniors as a senior, like when I get to be, that old, because I probably won't be trying to do burpees and stuff with 20 years olds, but I'll still be teaching classes long well into my old age, God willing." So yeah.
Mhm. Oh, well, then I love it. So, how do you balance being a fitness coach, a personal trainer, and a social worker? How do you balance those roles?
It has been a juggle over the years. When I was younger, I did not balance it well at all. And I had to acknowledge that and recognize that. When I first started at the place where I work now, I started back there right out of grad school. So that was back in 2015. I went in bright-eyed, bushy-tailed, ready to save the world. And I was teaching classes at that time as well. A lot of classes too. So I was teaching like 12 classes a week, working full time as a social worker and just like on my grind, as they say. And I was being pushed too hard in one area, which is my social work side. I was being pushed too hard. And I wound up burning out and leaving my job in 2019 and going to fitness full time because fitness was where I felt my release. I felt my that was my way to replenish myself, to pour back into myself, was going to teach classes, was going to work out myself. And I'm like, maybe I just need to dive into that world full time, get myself back together, and then I'll go back to social work. And that's what I did. I took 3 years off, and then I went back to my job in 2022 and been there ever since. And it's so much different being there now and still, of course, teaching classes, training clients and everything than it was when I was younger. I didn't have boundaries when I was younger. I was never off the clock. I just did not have work-life balance at all. But now I'm older, wiser. I am very much so more intentional about my self-care. I wasn't really I was so focused on, well, once again, pouring out to others, teaching so many classes. Like, I got to teach more classes. I got to sub for other people too and teach the ones I'm responsible for and go do my full-time job to the best of my ability. And I was forgetting about RaGina and making sure that RaGina still was getting what RaGina needed out of this. I love working out. So making sure that RaGina still got her workout in, because I was to the point where I was so tired from teaching that I had no time to even work out myself. Like, by the time I got done doing my full-time job and teaching classes, I didn't want to see a weight or, a fitness mat or a gym or whatever. I want to see my couch or my bed or, seeing a book, or watching a movie like I did, which is also self-care in itself, but, not the way that, I really wanted to pour into myself. And so I had to realize, okay, if you're not going to dial it down in how many classes you're teaching, maybe don't do the full class anymore. So I had to figure out what works for me, because I was a person I wanted to do 100% of the class and still coach and empower, whatever. And that was energy depleting. And so I'm like, all right, I need to make a shift, especially in my older age. I'm like, I need to make a shift from doing the full 100% of the class to maybe doing just 60%, 70%, 80%, depending on how I'm feeling that day. Still empowering and coaching and doing all the rest of the stuff to, the max, but physically doing the workout, I had to decrease it. So that way I still had enough energy to be able to pour into myself and do what's best for me. Because like I said, I had previous knee injuries. And so there's certain, exercise and things that I need to make sure I stay on top of in order to be able to make sure that I don't have any type of relapses and, my knee injuries. And if I do that, then I'll be forced to sit down anyways, and I wouldn't be able to teach and train or do my full-time job. So I definitely had to work hard to get that work-life balance, but I definitely have it now. So I tell anybody who, is in the fitness industry and having a full-time job that's not, in the fitness industry, I would say make sure that you figure out what you need and then go from there in adding on to your plate. Because if fitness gets to be the point where it's more of a job than a passion and a love, and a way for you to have, self-care of yourself, then you need to, take a step back and kind of reevaluate things. And that's something I also had to realize, which is a part of the reason why I went back to social work. I was in fitness full time, and it got to the point where it was more of a job than my passion and me, giving myself self-care and self-love. And so I'm like, no, I think I'm ready to balance this correctly. And so I went back to social work and then still balance the fitness.
Thank you. So, within balancing being a social worker, a fitness coach, a personal trainer, and considering your other primary roles, what is a reminder to yourself to circle back to yourself to feel grounded?
Mm, good question. A reminder to myself that I say honestly almost every single day um, is to remember where you were, because when I left my full time job, I was completely depleted, burned out, felt like I wasn't, I honestly, I didn't think I would go back to social work. I told everybody I was going to go back, but I didn't even feel like I could go back. Like I was just so burned out. And I'm in child welfare. So anybody who works in child welfare education, we all know how hard that area is. And so, I felt like I couldn't go back. And then when I was in the fitness industry full time and then feeling like that wasn't filling me up either, um, I was like, okay, this isn't it either. Maybe I don't need to be doing this either. And I honestly started thinking about having an entirely new career trajectory. I even talked to one of my sisters about it. I'm like, maybe I need to go to another profession altogether. Maybe I need to go back to school. Maybe this is not what I'm meant to do. And can we take a break
Of course. I'll
real
pause
quick?
it.
I just got to open
Yeah.
the door. Okay. And I don't even remember what I said last.
So, you were talking to your sisters about possibly
Oh,
having a whole new career trajectory.
yes. So yeah, I even talked to some of my sisters about having a whole new career trajectory, saying maybe I need to go back to school. And that feeling was scary, to be completely honest, like terrifying to be almost 37 years old, graduated from the last institution in 2015, and then thinking about going back to school. And I know that people are going back to school more and more, in the 30s and 40s and even 50s. But for myself personally, it was terrifying to think that I would have to start over, figuring out what I wanted to do with my life. But after having those conversations and just sitting down and reflecting on why both sides of my professions, and who I am were not meshing and were not doing what I needed them to do. That reflection was everything. So now I just remind myself, I'm like, remember who you were and where you were, and remember where you are now. And it's all about balance. Like everybody says it, but really, I just remind myself every morning. It's like, and I say to myself, I say, "RaGina, balance it out,
Mm.
balance it out." So if it's a day where it's really hard and I'm in court and I got rough cases happening and things like that, balance it out. If it's a day where I'm not responsible for teaching classes, then that means I'm hitting the gym, like on my own, doing my thing, like balance it out. If it's a day where I got light cases, but I'm teaching a bunch of classes or subbing, all right, balance it out, RaGina. All right, I'm gonna go watch a movie when I get home, or I'm gonna read a book, or I'm gonna go for a walk with my dogs, or I'm gonna spend time with my partner. Like balance it out, because otherwise, I know I'm gonna go back to being in the same situation that I was in 2019, and then again in 2022. So I don't want to have those feelings again. I know that I'm doing what I'm meant to do, in both sides, in the social work and in the fitness side of things. And so it's just a matter of me continuing to balance it out.
Mm. Thank you. That sounds like another motto for yourself.
I just
Yeah.
thought about that as I said it. I'm like, I think I have a new motto.
I love it. So this sister circle community is named Luray Journey. What Luray mean in love is real and eternal. What is your understanding of love being real and eternal?
So it says it in itself, like love is real. Love is something that you can touch, you can feel, you can sense it. And like I said earlier, there's so many different types of love. And it can it's one of those things that it can come and it can go depending on what type of love it is, but at the end of the day, true love is eternal. Like God's love is eternal. It's unconditional, it's everlasting. And so we, as I said earlier, have to love ourselves, and that has to be eternal. And if you do not love yourself, like I said earlier, you cannot completely pour love into others. And so having that constant internal conversation with yourself, where any step that you're at, any stage you're at, phase you're at, transition that you're at, continuing to love yourself, that is what's going to be everlasting. Okay, because love can come and go from people, from things, from whatever, but if you have that love for yourself, that will never go away. And sometimes we have to, renew that love through different things and self-care and things like that. And acknowledging, like I said, that where we are in our journey in order to be able to remind ourselves to give that love. But once you do, it's there. It's there. And like I said, sometimes it has to be repeatedly reminded, like, I love myself. I love myself. Like, I'm imperfect. I don't have it all together. But I love myself. I'm not who I was. I might not like who I am right now. But I know who I want to be, but I still love myself for who I am today. And once again, giving yourself grace that, everything's a process, and time, you'll get to where you want to be. But today, love yourself, love who you are, because love is a journey, just like everything else.
Mm-hmm. Thank you, RaGina. So where can folks find you in the public space? Are you on Instagram, for example? Where can folks find you?
So I am horrible about social media, but I do have an Instagram, though. I do have an Instagram. It is Kiss G Fitness. And you can find me on there. So if you DM me, I will totally, maybe not the same day, I'm doing better. But I totally will get back to you. If you're in the Philadelphia, New Jersey area, you can find me. I teach classes and train clients at Lumos Yoga and Bar. We just won Best of Philly last year, 2024. So definitely one of the top fitness studios in the city. You can also find me. I do have a website that you can go on that you can also find me. That is kissgfitness.com. And you can go on there and read about me and also reach out to me, and we can talk. Like I said, I'm all about building villages. So even if, I don't wind up being your trainer, your coach, and you just want to know who to connect to, or like I said, do that consultation and have that conversation, I can do that as well. My goal is not to get clients. My goal is to help people.
That's good. Thank you again. This was really insightful and inspiring. Yes. So thank you again, RaGina, for sharing your journey and reflections on love during this season. Thank you, sisters, supporters, and sponsors for listening. You can join the community by following the podcast across social media, including YouTube, Spotify, Instagram, and Twitter, using the handle @LaRaeJourney. And all of your favorite streaming devices. Be sure to leave a comment, a like, or review. Also, you can sign up for the newsletter by going to podcast.mckissickhealth.com. And as always, love is real and eternal. In community, peace.
Hey, LaRae Journey community supporter. You can follow the community by following the handle @LaRae Journey on Instagram, TikTok, and YouTube. Also, be sure to leave comments on Spotify, YouTube, and follow wherever you're listening or watching the podcast. For those who are part of the book club or love to discuss books and movies, you can follow me at Sherella Cupid on the Fable app. Lastly, you can go to podcast.mckissickhealth.com to sign up for the newsletter. There, you'll receive updates such as new episode drops, events, and so much more. Again, go to podcast.mckissickhealth.com. And as always, love is real and eternal. In community, peace.